Brian Pogue. I'm the new editor of the Journal of Biomedical Optics. I work in optics and medicine at Dartmouth College in Hanover, New Hampshire. I am a professor of engineering science and I have a cross appointment in the Department of Surgery. And at the medical center, we've got a Center for Translational Medical Optics Imaging. We call it the Center for Imaging Medicine. So the scope of the Journal of Biomedical Optics is intentionally broad. It's an enormous field capturing everything from surgery, medicine, drug development, cancer, neurology, the breadth of medicine, but that cross-sects with the technologies. Right? And the technologies can be anything from microscopy all the way up to surgery, all the way to radiation therapy, to different types of guidance technologies. And it's really that intersection between the needs in medicine and the technologies being produced by engineers and physical scientists. It's that intersection that is the journal, the scope of the journal. And so it's intentionally broad and intended to catch papers from both those sectors and with the focus on translation. I think more and more as the journal has grown and matured, but making that connection is one of the things that I would like to do. Having industry a little bit more involved as they can be in publishing, and having academics be a little more responsive and connected to industry so that we really bridge that translational gap. I view a journal as a community, the community that brings people together, and SPIE is the community for biomedical optics. It is the single largest community in the biomedical optics world. And BIOS, the conference where we meet every January, is the venue where we present to each other. And the Journal of Biomedical Optics is the issue, the paper issue, or now the electronic journal that we all publish in to represent our community. So to be involved in that journal and to help it chart where it's going in the future is just a natural piece of service to the SPIE and Biomedical Optics Society. So the single biggest factor that is going to impact Journal of Biomedical Optics in the next year is this transition to open access. It will allow our papers to get viewed by everybody in the world. It's a fantastic opportunity to reinvigorate your publishing with JBO. So if you are a biomedical optics researcher doing translational research, working in a hospital, working in an engineering school, and you have innovative discovery, this is the perfect time to consider publishing with the Journal of Biomedical Optics.